I'm Lauren Ellis, and this is my patient. I'm going to wash my hands with the appropriate soap. Hi, Miss Stroh, how are you doing today?
I'm good.
I'm going to be doing your physical exam, okay? I'm going to first just feel your pulse and see how you're feeling.
Thank you so much. You're welcome. Have a safe drive home and have a great week. You too. Do you have access to our student partners offices? It's upstairs. Okay. If you go up these stairs here.
Perfect. They're equal and palpable. They're at a normal rhythm and rate. Your current rate is about 68 beats per minute.
Excellent.
Your skin looks warm, dry, and intact. You have normal hair growth, and you do have some freckles, but they all are within the normal ABCDEs of freckles and moles. Your nails look good. All right. So I'm just going to and I'm going to look at your respiratory rate real quick. So just breathe normally. I know this can seem a little weird, but your respiratory rate is great. You're breathing about 15 breaths per minute.
Cool.
I'm now going to palpate your head. This may feel a little funny, and just go from there, okay? I'm just palpating for any bumps, nodules, any abnormalities. Have you ever noticed anything?
No.
Just going to look through your hair, make sure you don't have any nits or any skin lesions, and everything looks really good.
Excellent.
Okay, I'm also going to palpate your sinuses. Is your frontal sinus any pain there?
No.
How about when I push here?
No.
All right, I'm going to go on and palpate your preauricular glands and postauricular glands. How are they feeling?
Normal.
Normal? Okay.
No
and
pain.
No pain. And then what I'm going to get you to do is I'm going to get you to open your mouth and close. Your temporal mandibular joint feels normal, and does it elicit any pain when you open and close it? No? Okay, perfect. Okay, now we're going to start with your eyes. I'm going to get you to follow my finger as I move it, okay? But don't move your head. Keep following. And then what I want you to do is now look at the coat rack on the outside of the room. Good job. Your pupils were equal and reactive when you looked to the outside, to the coat rack, and the eyes moved appropriately. Now what we're going to do is I'm going to get you to hold this eye chart 14 inches away from your face, and I want you to close your right eye and read the line that has the smallest print that is visible to you.
4, 2, 6, 7, 3, 9. Right, up, down, 0, 0, X.
Okay, and do the again with the opposite eye.
9, 7, 2, 2, 5, 5. Right, up, left, X, X, O.
Good job. And you read this one, right?
Yeah.
And that is the 2020. Okay. Next, what we're going to do is I'm just going to check your pupils for equal reaction.
Okay.
Okay. Stare straight ahead. That one constricts appropriately, and so does the opposite eye. This one constricts appropriately, and so does the opposite eye. I'm going to look from the side, just stare straight ahead. I'm just looking at your cornea and your sclera, and everything looks intact and appropriate. Same with this side. What I'm going to do now is just look in your conjunctiva, in your eyelids. Eyelids appear good. Conjunctiva is moist and not inflamed. And your eyelashes and lids are intact and hair growth is appropriate. Okay. All right. Now what I'm going to do is we're going to turn off the light and we're going to do your eye exam. Okay?
Okay. Good, you can still see.
Oh, perfect. All right, look straight ahead for me. All right, we're eliciting the red reflex. I'm coming in and I can see the optic nerve and the 4 vessels and look straight into the light. And the retina looks appropriate. I'm going to give you a second to adjust that real quick. And we're going to do the same on this side. Going to elicit that red reflex. Come in, I'm looking for the optic nerve, and I see it, and the 4 vessels, and stare straight into the light again. Good job. And the retina looks appropriate. Okay, now we're going to move to your ears. We already looked at your pre- and post-circular glands and those felt normal. Otherwise, your external ears feel appropriate and they structure is normal. I'm going to get you to occlude one ear and I'm going to whisper something in your ear and let me know if what I said.
15.
Good job.
24.
24. And that is appropriate responses. Now I'm going to close your eyes one more time and tell me if you can hear my fingers.
Right. Left.
Good job. Perfect. Now I'm just going to look at your ears with the otoscope. Let me know if any of this hurts. Don't want to hurt you. All right. Tympanic membrane looks intact and no fluid behind it. And the otitis externa looks normal. And same on this side. Tympanic membrane looks good and otitis externa looks appropriate. Okay, what I want you to do now is I want you to occlude one side of your nose or the other and take a deep breath in. Okay, and the other one. And did you find any difference when you took a deep breath in?
No.
It sounded like the left one a little bit, was maybe a little bit. Okay, now I'm just gonna look at your inside of your nose with the scope as well. And we already palpated your sinuses and those didn't bother you, correct?
Correct.
All right. Just gonna look here in your nose. I'm just gonna place my hand so I don't hurt you. Right, and the nose structures look good. No redness or inflammation. Turbinates look good, along with this side as well. Okay, now what I'm going to get you to do is I just want to look at your mouth. Your lips and look appropriate. They look moistened, not dry or cracked, healthy. So can you say ah for me? All right, uvula looks good, mucosa is good, tongue looks appropriate and normal, and underneath your tongue looks good with no lesions. Teeth, then the structure of your teeth look normal and your gum dentition looks good. Okay, now I'm just going to feel for the rest of your nodes and just feel if you have any tenderness, let me know. These are your superficial cervical nodes, your posterior cervical nodes, supraclavicular, feel under your submandibular and sublingual. And everything feels really good. Any pain when I palpate? All right, I'm going to feel for your trachea, and that is feels midline. Any trouble breathing?
No.
No, it doesn't appear so. Your respiratory rate is normal. Now I'm just going to feel for your thyroid. And it feels normal. And what I'm going to get you to do now is, so when I say swallow, swallow. Okay, swallow. Oh, perfect. Thyroid feels in place and it elevates and drops as appropriate when asked to swallow. I appreciate for your time. Thank you very much, and your exam is normal.